Namaste. COVID-19 pandemic due to lack of treatment availability had brought a sense of fear and anxiety around the globe. Divya-Swasari-Coronil-Kit, a traditional Indian Ayurvedic medicine, has been approved as a supportive measure against COVID-19. We have conducted a real-world exploratory study to determine patient treatment satisfaction receiving Divya-Swasari-Coronil-Kit and its correlative impacts on psychological health and quality of life based hypothesis. We conducted a web-based cross-sectional study. We collected data related to demography, psychological health, quality of life, and treatment satisfaction. Out of 680 invitees sent for participation in the Satisfaction COVID survey, 367 participations completed the inclusion criteria and consented for the study. Our results showed that Divya-Swasari-Coronil treatment led to decrease in physical symptoms, which was correlated with better psychological health and quality of life. Global satisfaction from the treatment regime led to improvement in psychological health also. All segments of Coronil-Swasari treatment satisfaction, which comprises effectiveness, convenience, and global satisfaction, positively associated with the quality of life. Categories of socio-demographic details such as marital status and socio-economic class correlated well with the treatment satisfaction. Medication taken together, this pilot study indications that treatment satisfaction from Divya-Swasari-Coronil-Kit has its positive implications on psychological health, quality of life, and demographic factors. Namaste.